I'm here today with Dr. Robert Schroering, owner of Advanced Implant Centers. He's been working for over 36 years exclusively in placing implants, and he's done this for over 36 years, transforming lives. You've done almost over 19,000 of these procedures, and not only that, you've trained dentists all over the world, more than 10,000 dentists, not over the world, but also here in the U.S., and kind of become the go-to locally here in Louisville. Why is that? Why do patients come to you?
I was one of the first dentists to start doing implants in Louisville, Kentucky, and I realized at the time, if I really want to be good at something, I need to do this and do only this. And so I really focused on it early on. That allowed me to get into some of the newer techniques, actually helped develop some of the newer techniques, to bring some innovation to them, which I've been able to do, and that's why I've been asked to speak and train other dentists. It's just been exciting, and a lot of patients come to me now just because they know somebody or a few people that they know that I did implants on.
Yeah, if you've done over 19,000 of them, there's quite a few people around.
There's a lot of patients walking around with implants I've placed, and the best thing for me is to see them years later, sometimes 30 plus years later, and see that their implants are still doing great. I take a lot of pride in that because I don't want them to have any problems.
We talked a lot about that's what people want to know when they come to you, is that their surgery is going to be successful.
Yes.
Tell me about that.
Well, every patient wants their surgery successful. You know, they tell me that they've had people praying for them and they're really concerned, and everybody's a little nervous about surgery, and they should be. I want to make sure that what I do is not just successful the day we do surgery, but I want it to be successful for 10 years later, 20 years later, 30 years later. And that really comes from engineering it properly, putting the right implants in, doing the right technique. Unfortunately, I do see a lot of patients that come in and they've had implants that have failed. And somebody has done them not the best way. I'm not trying to knock other doctors. And the problem with that is now you've got to do a lot of reconstruction because it's not just the implant itself that's failed, it's the bone around it is gone. And so we have to do some other complicated procedures, but we're able to do that. But I want my patient to have one surgery and hopefully one surgery only so they never have to worry about it.
Your patients probably say it best because we talked to some of them earlier. They feel very comfortable with you. We want to hear from some of them.
And I had all the confidence in him. He could do it. He said he could do it, and I believed he could do it. And talking to other people in the office, you're going to love him. And hey, pretty good. He's excellent, actually.
Went to see Dr. Schroering, and he said that he could help out with the implants, and so I went ahead with him and let him do his thing, and it really turned out great.
Very happy. In fact, I'll bring tears to my eyes, but yes, it was from the day you walk in the office, it's like family.
Dr. Schroering teaches throughout the world, and he is the top gun in this field as far as I'm concerned, and I want the best for myself and I want the best for my friends, so why wouldn't I go out and tell them?
Doc, that really has to feel good to hear that from your patients.
It really does. I mean, it excites me when a patient comes in and tells me that we did a great job and tells me that it really has changed their life in many ways.
You know, you've been doing this for over 36 years and you have an over 600% higher success rate than some comparable offices. How are you able to do that?
Well, for one, I hate failures. And I can do different things to make sure that the implant works. I mean, this is all I do. It's quite different because a lot of doctors, they may do implants, but they do other things as well, whether they're a periodontist or oral surgeon. This might be 20% of what they do. I like to equate it to this. When somebody's learning the guitar or playing guitar, let's say they do it twice, 2 hours a week. Well, they're going to learn how to play some songs and be pretty good. But if they're doing it 40 hours every week, they're going to be really good. And they're going to be innovative because it's natural for them. I learned a long time ago, can't do everything well, but I can do one thing really well. So I focused on this early on from 1993, and it's been wonderful because I can give that success to patients. That surprises me sometimes. You know, the average is 6% failure after the first year. And when you calculate that, that's 1 out of 16.5 failures. So one implant for every 16 you put in are going to fail. That's way too many. Our success rate is 0.58% when the patients follow exactly what we want. And that's 1 out of 172. So I rarely have those failures walk in. Now some patients cheat a little bit, start to smoke again because that's a big detriment for implants. So we edge that up to 1%. But still, 1% is 600% better than 6%. And that's 1 out of 100, not 1 out of 16. I really want to do everything I can to make that successful for the patient. That's my goal for every patient.
You know, what are some of the reasons that you hear people coming in and they hold back from doing this?
Patients are afraid sometimes. You know, they're in the condition they're in because they haven't seen a dentist. They have fear, they have phobias. So we have, I think, the only office in town that has a nurse anesthesiologist full-time in the office. So we can make them very comfortable. We can put them to sleep. Tell us that the pain afterwards is really not that big a deal, a lot less than they ever thought it would be. And we try to do everything in a minimalist fashion, so we don't want to be too aggressive with our surgeries, but we want to do the surgery properly. And that gives us the ability to do it as pain-free as possible. And we have a lot of patients that come in and it's finances. And so we've really evolved to the point where we can do finances for everyone now. And that really is a help for patients who they want to get teeth. They don't have that sitting in their bank account, but they can get it now, just like when they buy a car, they finance it. They can do that as well with their teeth.
And once someone decides that they've overcome some of those fears and the finances and things like that, how quickly are you able to transform their lives?
Well, we try to get patients in as soon as we can. And we have, I have a partner with Dr. Kwon, and that's really helped because before I was just extremely busy, and he's excellent at what he does. So we can get patients in pretty quickly. And the joy of that is we can change their life quickly because something's tipped them off. You know, a lot of these patients that have these problems for years, and something made them say, okay, I'm done with this. I need to get this fixed. They'll come in and say, well, at Christmas, I never smiled in our Christmas pictures. My grandkids will say, you know, Grandma, why don't you smile anymore? And they feel bad about that, but they're hiding things. When people hide things, they're not being themselves. So they want to have a life change. They want a quality of life change.
You know, I think we heard some of that from your patients too when we talked to them earlier as well.
This procedure 100% changed my life. I feel more confident in my health. I love to smile, maybe sometimes too big. People go, whoa! But yes, it changed my life, and I feel happier. I feel like he gave me my smile back, and that's priceless, in my opinion.
I'm not as self-conscious as I used to be, and that grows over years and years. You get so used to hiding yourself and not smiling and stuff. It takes time to get over it. I'm just now learning how to smile again.
This has changed my life drastically because I wouldn't go out and smile anymore because I didn't have any teeth. I'd had dentures, but the dentures would fall out. I could never wear the bottom dentures because they would never stay in. So I could never go out and eat with anybody. I'd always stay at home. So it's been a great change.
I enjoy it. I enjoy eating a steak. I enjoy eating corn on the cob. I enjoy smiling at my grandkids.
When you see these, I mean, you're proud of them. Actually, you got to watch yourself. Like I told you before. It makes other people self-conscious because they look so good. Yours look so good. Theirs look, they cover their mouth when they talk to you. But it's just it's just a big time confidence booster.
That's so encouraging to hear because you really are changing lives. Can you talk about what people have seen before and then also how you're able to address some of that?
Well, Janelle, I think I have the greatest job in the world because when we put those teeth in patients and they see the difference, many of them cry, many of them get very emotional. As a team, we do the same thing because we know that this is something they wanted all their lives and now they have it, and it is life-changing. They tell us that all the time. I love seeing my patients 6 months after we've done the procedure when they come in for the recall appointment, and they'll tell me, Doctor, thank you. And they'll say it a few times. You know, I get a little emotional about it, but they tell me all the things that are different in life. Their relationships are better. Some of them get promotions at work. They just feel better about themselves, and they can chew and eat foods that they never were able to chew and eat. It's amazing, and it's just, I think I'm the luckiest guy in the world.
It's all those little things that add up over time that you don't realize have been happening, and then they finally do the procedure and they can do the things that have been missing.
Patients tell me all the time, I don't know why I waited so long. It's the best thing I've ever done for myself.
You know, we talked about your experience a lot, and you've been able to train doctors not only nationally, but internationally. We talked about over 10,000 dentists all over the world. Tell me about how your experience has led to that.
Well, I've always been on the cutting edge, and because I think early on I focused just on this, and I really have been a person that looks for what can I do to make this better? How can I improve on this? And so I've been able to add some procedures that do improve on what we've done. And even some of the common procedures that are done today, mediate lobe, mediate function, 83% of dentists don't do that today. And it's shocking to me because I've done it for 26 years and it's so much better for the patient. But I think just looking for what we can do to make things better for the patient is the key.
And I think that's successful because we want to bring in Dr. Brian Kwon. Now, you have so many patients who want to see you, and you've talked about that. You've brought in Dr. Kwon as well to kind of help out in transforming lives here in Louisville.
Well, I did a national search, and I really took my time. I wanted to find a guy that was really qualified and that really knew what he was doing. And he is amazing. You know, he's younger than me, he has a lot more sense about the technology. And he's been able to utilize that because there's some great things that we can do today. AI guided surgery, other things, and he's taken that bull by the horns, and he's done well with that.
Dr. Kwon, could you talk about some of that technology that you've become an expert in?
Yeah, sure. So when it comes to implant dentistry, close enough is not good enough. So that's why we started using X-Guide dynamic navigation system. So what that is that it's just like a high definition GPS for implant surgery. So we talk a lot about AIs nowadays, artificial intelligence. So you know, it changes our lives in many industries. But in dentistry, this is it. This is how we use AI to provide us implant surgery with such a high accuracy and precision. So it's gonna let us know, it allows us to see exactly where implants are going in. It's gonna tell us the depth, position, and angles, and it's gonna allow us to avoid all the important landmarks, anatomic landmarks such as sinus and nerves that we have to avoid violating at any cost. So we're the very, very few offices in Louisville that utilize this latest AI guided technology, and it really allows us to provide most safe and predictable results that we already do.
We talked to Dr. Schroering already about the success rate, and it sounds like with this, it's even helping to improve some of that. Can you talk about how this office that you're working at now here in Louisville is different than some of the other places that you've worked?
So the reason that I was very excited to join Dr. Schroering's offices is first that when I come to meet him and took a look at his office, such a compassion for patients is outstanding. So we in this office, we don't treat our patient as chart numbers. We treat each patient like a family, and each patient is different. So we make sure that everybody's being taken care from the start to end. So another thing that is such an expertise and experience Dr. Schroering has, and we, as you know, we do everything in terms of implant dentistry from start to beginning. So we do surgery, we do have an expert lab technician in-house, and we fabricate everything in-house so that in any complication arises, we take ownership. So, so we really take our heart to have a success result and take good care of our patients.
I think both of you, that's so important now because we've gotten to this medical system where people do feel more like a number, and to put the heart back into it. I think we heard that from a lot of your patients as well, if maybe we want to go hear from some of your patients.
And he did the 3D pictures and he knew exactly what I had. He said, oh yeah, I can do that. I said, really? So he said he'd do it, and we did it.
From the time I went there, the very first time, everybody was very friendly, very informative. He had a plan that he came out with the first time I was there, and shortly thereafter it was all done.
he was amazing. And what he told me was nothing that I didn't already know, that my teeth were in bad shape, that I had some infection in my sinuses, and that was making me ill, more or less. And so, you know, he was completely honest and said, I really suggest that you do it sooner than later.
When I first walked in, everybody's friendly, and you know they're there to help you, and they're generally concerned, which just instantly makes you feel comfortable, and you know, which relaxes you, which makes the whole experience a lot better.
You know, it's so cool to hear that kind of stuff. Dr. Kwon, when you hear a patient talking like that, how does it make you feel?
So people often ask me why I decided to focus my scope of practice in implant dentistry, especially the all-next 4 miles reconstruction. And when I hear a patient like that, and what patient, I know that what I do change people's life, and it's extremely gratifying and also humbling too, that what we can do to impact patients' life in such a way. I do respect you know, other aspects of dentistry, but there's I believe there's no other procedure that impacts patients' lives in such a way that we do.
Absolutely. And Dr. Schroering, how does that kind of fit into your practice philosophy?
I'm glad you asked that, because our practice philosophy, you know, there's a couple golden rules we live by, and you know, biblically it says, treat others the way you want to be treated. And I live by that rule. And with every patient, I think about how would I want to be treated in this situation. And if I was to go to somebody and get treatment, which I have a couple implants, I would want somebody that really knows what they're doing, that's going to have great experience, because I can trust them, because I know they've seen things that you don't always see when you don't have that experience. Also, I want somebody that's compassionate. You know, Dr. Kwon mentioned that, and we try to just have the utmost compassion for all their patients and make sure they feel comfortable. Patients tell us all the time that I've had patients tell us, I was always afraid to go to the dentist, but I love coming here. And that's a great compliment, and we love hearing that. But it comes from all the staff members, treating patients the way they want to be treated. And the other part of that is finances. I want somebody that's going to be reasonable. And so we try to make it affordable for everybody. And we do that in a lot of different ways. But I want somebody that's going to do it well, that knows what they're doing, going to do the best quality. I don't want any corners cut in our office, and we don't cut any corners. We use the best products. We use a newer implant that I think has a game-changing coating. I was part of the design for that implant, and I speak and lecture on that now. But it's amazing. We've done about 500 of those now, and I have yet to have one failure with that implant.
Because as you mentioned, this is something that has to last years, decades. You've seen people who are maybe had this done 30 years ago.
Yes, and when I see them 30 years ago and I see them look like the day I put them in, then that's success. That is what we're looking for. I don't call somebody getting it for 20 years, somebody would say, well, that's successful. I don't consider that successful. I think these things, implants can always be something we can put in and have last for a lifetime. If they're doing their part and we do our part, then it should be able to do that. And I'm glad to see patients that it does last for a lifetime.
Well, Dr. Kwon, we're so glad to have you in Louisville working with Dr. Schroering. We want to listen to a few more of your patients that have seen success.
Going to Dr. Schroering was life-changing, because there was no pain with it at all.
I have talked to people that have noticed, you know, that I'm smiling, or they've noticed my teeth, you know, and they'll ask questions, and I say yes. That's the place to go. That's the only person I would even consider.
People around me couldn't believe it. They were like, I can't not believe what you've just been through, and you look great. And so, yeah, it was incredible.
You know, Doc, I think that's what we're hearing over and over and over again, is this is really transformative. You have people changing their self-esteem, their position at work, their relationships.
I had a lady come in with her husband, and he had just gotten his teeth, and she said, for 25 years of marriage, when I first married him, he smiled all the time. And then when his teeth went bad, he never smiles anymore. Now he can't stop smiling. He is so happy about this, and she loves it, because she knows that she has a husband that's in a maybe a better mood. And it really shows that he's in a good mood. But before, I don't think his mood was bad. He just didn't want to show his smile. You know, a lot of people cover up their mouth. They get into pictures and they don't show their teeth, and they just feel self-conscious, and that really weighs on a patient. And when they can get over that and then have something that's beautiful, that is part of them, that just makes them feel great. And when they feel great, they have better relationships. And when you smile at somebody when you're talking to them, that helps that relationship.
Because the smile is the universal language, really. And,
yes.
And people maybe at home are watching this right now and they think, okay, I am ready to move forward with this, but how in the world can I afford this? Can you talk about that a little bit?
That's a great question, because a lot of patients, you know, that is one of the big factors for them. So we have a few companies that we work with that give financing, and they do a great job with that. We have our implant coordinator helps just steer them through that process. But also recently we've gone in and we have a package that is financing for everyone, meaning there's no credit report. So they can come in and they can get credit no matter what for them to be able to finance this. And that's a game changer, because a lot of patients come in and you know, they just don't have the ability to get what they need to be able to start the process. This enables everybody to have that ability and everybody to start that process.
And you're also doing a lot of things in your office to kind of keep some of those costs down.
We do. So if in the past, and in a lot of places, you go to one place and you get your surgery, you go one place, you get your teeth placed, you send it out to a lab. So you have 3 different entities and each one has to make a profit.
And all those bills coming in.
All those bills coming in. And so the price is much higher. So we work really hard of keeping the cost down. We keep everything under one roof. So the lab is there, which is huge, because if you're sending this product to a lab person who's sitting there and never has met this patient, can't see the teeth in the mouth, they're never going to do as good a job as what we could do in-house. And we can control our cost. More so, we can control our quality. So we are significantly less, you know, in this inflation environment we've had for the last 5 or 6 years, our price has gone down.
Wow.
It's not gone up, and we've been able to do that by just making sure that we streamline things. Plus we do a lot of volume. So the more we do, the more we can help keep the cost down for the most patients.
You've seen all those patients, and you've probably heard some of the objections relating to cost. Can you talk to me about someone that you heard that was kind of doing that mental math in their head?
I have one patient in particular I just thought of, and it's he came in and he is a tool and die maker and just a great gentleman, and he said, I've saved for 5 years and now I'm going to get this done. And so he put a small sum of money every month, and he came in and he was able to pay cash for it. And then when he was done with the procedure, he said, you know what, I wish I've never done that. Meaning, saved up for 5 years. He said, I could have done this 5 years ago. I said, I love what you've done. This has just been a game changer for me. But if I'd have done this 5 years ago, I could have paid it off for 5 years, and I could have had the enjoyment of having my teeth for 5 more years. He said, I wish I would have just financed it. And that really spoke to me, because that made more sense.
And that also feels like a big responsibility for you, because you know, I'm listening to you, and you realize that this is something that people are really working toward, and so you're keeping that in mind when you're working with them.
Yes, yes. So we know the patients, the process for a lot of them. And we have patients that come in and they may have a consult, and at least then they know what they need. And they may come back a year later before they get the treatment. And that's fine. You know, our job is to give them their options, help them understand what we can do, and make sure that we just take care of their needs.
You talked a little bit about what happens, but if I'm watching at home right now and I think, okay, I really want to come talk to Doc, what's the process once I've decided to take that step?
I know our phone number's on the screen, so I would say give us a call. Come in, we'll have probably about an hour and a half time. There's no cost to that. I never want to go in and be charged for something until I know the price. So we don't do any cost whatsoever. Now we do a scan, a CBCT scan. It's like a CT scan. We do an exam. We spend a good amount of time. Something that we charge for would be about $700, but we do that for free. And that patient then has all their options. They know what to expect. We go through all the treatment, and that's, I think, the best thing we can do for any of our patients.
You talked about some people come back maybe a year later, but some people are like, hey, now that I've made this decision, I want to get it done now.
The vast majority of our patients want to do it as soon as possible. And when I leave the consultation room and have given the diagnosis, given the options, they'll say, when can we start? And we try to get them in as quickly as we can. The beautiful thing is, this used to take a year of treatment and 3 different surgeries to do the same thing we do now in one day. So in one day we can take all the teeth out if they have bad teeth. Sometimes they come in with dentures, we can put their implants in, and that day or the next day we give them their teeth. And that's when you see the life change begin.
What's the recovery like though? You've got now new teeth, and I'm thinking, well, maybe I've got this downtime, I can't miss that much work, that kind of thing. What's the recovery like?
Surprisingly, it's not bad. Patients tell us that it was a lot less than they thought it would be. Now, everybody's a little bit different. We have probably 40% of the patients just say, I didn't even need pain meds the next day. And this is where we're doing both upper and lower jaw. Now, there's a 40% that swell and bruise, but they say, I really didn't have much discomfort. And then there's 20% that say that, you know, I had a little bit more bruising and some pain for 3 or 4 days, but we give them pain meds for that. But majority of our patients, if they have the surgery done on a Thursday or Friday, they're back to work on Monday. And that's good. We don't want to have a lot of downtime for these patients.
Immediately the appearance changes. What about the things that you can eat and things like that?
Well, initially, once they get to their final teeth, they can chew and eat anything they want. They can eat peanuts, they can eat a salad, they can eat anything they want. And
apple is a big one, right? People think about apple with the teeth.
But I want to mention something else, and this is a key point. It's not just aesthetics, it's not just feeling better about yourself. A lot of patients come in with infection, and they don't know they have infection there. And infection can be really disastrous for a patient. If you have dental infection in the mouth, which we find routinely on a lot of these patients, even when they've gone to a regular dentist, because our machine can pick up things that the regular dentist doesn't pick up. And those patients have 2.7 times higher risk of stroke and heart attacks. I've had patients in their 30s come in and they've already had a heart attack, 30 years old. That's because they have infection in their mouth and they never had that dealt with. So I'm really glad when those patients come, because we're doing more than just helping them feel better and look better and have better self-esteem. We're helping their health and hopefully giving them a longer life.
Absolutely. We want to, as we're starting to wrap this up, we want to hear from a couple more of your patients, because they're really the reason you do this.
Yes.
So I would recommend Dr. Schroering to others, and I have already recommended him.
I would 100% recommend Dr. Schroering. From the time I walked out of that office, people started popping up in my head. Who can I tell? Who can I tell?
I enjoy smiling, but I have an issue that this wonderful mustache gets in the way, and I don't show my pearly whites as much.
I have recommended Dr. Schroering, and I would continue to.
Well, we really appreciate hearing from those patients. We've appreciated you being here today, and if there are people watching at home who want to talk to you, what should they do? How can they get started in this process?
I think the easiest way to start is just give us a call, and we're looking forward to seeing you.
All right, Dr. Schroering and Dr. Kwon, you can get in touch with them at the number that you've seen on your screen. Advanced Implant Centers, you can give them a call today.